Hi, I'm Leanna from PACOP and welcome to our Clinical Bites series. Today, in our Clinical Bites for care workers, we're talking about the SAS for care workers, distress from sleeping problems. So the SAS fits in our range of a suite of assessments, and it's our assessment we use to determine someone's experience of distress. Having these conversations around someone's experience of distress can be really helped by using the range of resources we have available here at PACOP for having those discussions. We've got the PACOP ruler, which you can see here, which is in 2 different sizes and available in 12 different languages, which you can access via our PACOP website. We've got the resources here, you'll see on the right, around how to document what a person's experience of distress, what they tell you about their experience of distress. And you can see that this is the form you document in. There's a really great resource that you can hand out to residents and their families. It's a printable form entitled "Your Symptoms Are Important to Us." Now, this form is a really great way of starting that discussion with the resident around the process of the SAS, why you're asking them about their symptoms, and why it's important for you to know what's bothering or distressing them personally. So when we're using the SAS, we're asking the person about what their experience has been over the last 24 hours. So particularly today, we're asking someone about their sleeping problems. So we want to know about how much does it distress this person that they've got sleeping problems. And if you know that the person hasn't been sleeping well, you might like to ask how much this bothers them. And that will help you with the score on the SAS. So the best way of having a chat around using the SAS around sleeping problems is to have a chat first thing in the morning, or when you're providing personal care for someone throughout the day, or if you see them sleepy throughout the day. And that might be a great trigger point for you to see, ask someone in the morning how they've slept overnight, or if they're sleepy throughout the day, ask them about their experience of sleeping problems. If they're sleeping okay, and if they're not sleeping okay, how much it bothers them. Is it something that is usual for them, or something that that is new for them that is bothering them? So if a resident isn't able to articulate themselves what in the SAS, then you can use what we call a proxy. Now, a proxy is yourself or someone else who's close to the resident identifying what are usual behaviours for the resident and what might be different for them today. So if you know the resident, you might ask yourself, is the person different today? If you don't know the resident particularly well, you might ask family, friends, or one of your co-workers who works closely with a resident. And the importance here, it's asking this from the resident's point of view. What the resident's point of view of what could be bothering them. So you use words that the residents would use, or use other words like insomnia, sleepy, or awake all night to describe their experience. And a great way of learning about the scoring system in the SAS is to read the score guide, as you'll see below. And these are in documents that you'll see in the PACOP shop. And you'll see that a score of 0 indicates that a resident states that there's no distress or shows no sign of distress from sleeping. 1 to 3, they may be tossing and turning throughout the night. 4 to 7, which is a moderate distress, may indicate that the person's tossing or turning, they're sighing or calling out, only sleeping for short periods. And severe distress may indicate they're unable to sleep or unable to stay awake. They might be agitated or constantly tired. It's a great resource to use to get to know and start those conversations about what could be bothering somebody. So finally, when we're talking about the SAS, the 3 R's are a really great go-to in terms of looking at. It's important to record what you're noticing. Look at the ruler and get an idea from the ruler around the action plan. And you can see the action plan here. If there's an issue absent, there's no action required. If a person's experienced mild symptoms, you report it to the RN or the supervisor within the shift. If there's moderate symptoms, report to the RN or supervisor within 30 minutes. Or severe, immediately. The 3 R's. So that's our discussion for today. Thanks for watching this Clinical Bite as a part of the Care Workers series of Clinical Bites. You'll find other Clinical Bites in this series on our PACOP YouTube page. Thanks so much for listening today and have a great day.